Right now, there are millions of Americans between the ages of 55 and 64 who are about to lose their food stamps, and they have absolutely no idea it is coming. They will find out the same way everyone finds out. A letter in the mailbox, official government letterhead, a deadline they did not know existed. And by the time they understand what the letter means, their 90-day window will already be closing. If they do nothing, and most of them will do nothing, because they will assume the letter is an error, their food assistance will be cut off for 33 months. Not 33 days, 33 months. That is nearly 3 years without a single dollar of help buying groceries because of a rule change that took effect less than a year ago and that most people in this age group have never heard of. If you are between 55 and 64 and you currently receive SNAP benefits, I need you to understand something clearly. The protection that kept people your age exempt from strict work requirements on food stamps is gone. It was removed by federal law on July 4th of 2025. It is not coming back. And the clock that determines whether you keep your benefits or lose them for 3 years is already running. Everything I'm about to tell you in the next several minutes is verified through official government sources, through AARP, through the Congressional Budget Office, and through the USDA Food and Nutrition Service. None of this is speculation. All of it is happening right now in every single state. And the difference between keeping your food assistance and losing it comes down to whether you take 3 specific actions within the next few weeks. Here is what happened and why it affects you directly. On July 4th of 2025, President Trump signed the One Big Beautiful Bill Act into federal law. Among dozens of major policy changes in this legislation, one of the most consequential targeted the Supplemental Nutrition Assistance Program, which Americans still commonly call food stamps. SNAP is the single largest anti-hunger program in the United States. It serves over 42 million people total. More than 11 million of those recipients are adults aged 50 and older, according to AARP data. The average monthly benefit for older adults is approximately $188, which works out to about $6.20 per day. It is not generous. It is basic survival support that keeps vulnerable Americans fed while they navigate the years between workforce displacement and Social Security eligibility. Before this new law, SNAP operated with a classification called ABAWD, which stands for Able-Bodied Adult Without Dependents. The ABAWD designation triggered the program's most restrictive rules, including mandatory work requirements and a strict time limit on benefits. But these rules only applied to adults between 18 and 54. Anyone 55 or older was categorically exempt. You could receive SNAP indefinitely without proving you worked any specific number of hours each month. That exemption was foundational policy for decades. It recognized that older adults face unique barriers to employment, including health limitations, age discrimination, caregiving obligations, and diminishing physical capacity. Under the One Big Beautiful Bill Act, the ABAWD age ceiling was raised from 54 to 64. This means that for the first time in the program's history, stretching back to the 1960s, adults between 55 and 64 must comply with monthly work requirements or face automatic termination of their food assistance. These new requirements took effect November 1st of 2025, and all states are actively enforcing them right now. You can verify this at the USDA Food and Nutrition Service website at fns.usda.gov/snap/work-requirements, at AARP at aarp.org/advocacy/snap-work-requirements-what-to-know, and through the National Conference of State Legislatures. Let me explain precisely what you are now required to do. If you are between 18 and 64 and classified as an ABAWD, you must complete at least 80 hours per month of qualifying activity. That averages to about 20 hours per week, though your weekly totals can vary as long as the monthly total reaches 80. Qualifying activities are broader than most people realize. Paid employment at any wage level counts, whether it is full-time, part-time, temporary, or gig-based work. Unpaid volunteer work at any recognized nonprofit organization counts. And this includes volunteering at churches, food banks, libraries, community centers, hospitals, thrift stores, animal shelters, parks departments, school districts, and any other charitable entity. Participation in a state-approved job training or workforce development program counts. Enrollment in educational courses counts, including GED preparation, ESL classes, community college courses, vocational certifications, and online training programs approved by your state. Participation in a workfare program assigned by your state counts. Any combination of these activities totaling 80 hours per month satisfies the requirement completely. There is also an earnings-based compliance path. If you earn at least $217.50 per week, which is the federal minimum wage of $7.25 multiplied by 30 hours, you are considered compliant even without tracking specific hourly totals. But across all of these pathways, one requirement is absolute and non-negotiable: documentation. Your claim alone is not sufficient. You must have verifiable proof of your hours, pay stubs showing dates and hours worked, a signed letter from your volunteer supervisor with their name, title, organization, phone number, and specific confirmation of your hours and dates. Training enrollment verification, attendance records. Without this documentation on file with your benefits office, you are classified as non-compliant even if you actually performed every single hour. The system does not differentiate between someone who did not work and someone who worked but failed to document it. Both outcomes result in benefit termination. The penalty for non-compliance is severe, and the timeline is unforgiving. If you do not meet the 80-hour requirement and do not hold a documented exemption, you can only receive SNAP for 3 months within any 36-month period. That is your complete allowance of non-compliant months. After 3 months without meeting the requirement, your benefits terminate automatically. You cannot receive SNAP again for the remaining 33 months unless you either complete a full consecutive 30-day period of documented compliance and successfully reapply, or you obtain a qualifying exemption with proper documentation. At current average benefit levels of $188 per month, losing SNAP for 33 months means forfeiting over $6,200 in food assistance. That is 3 years of meals subtracted from your life because of 3 months without the right paperwork on file. Many people assume their state can protect them with a waiver if local jobs are scarce. That assumption is no longer valid. Under previous law, states had significant flexibility to waive ABAWD time limits for areas with high unemployment or limited job availability. That flexibility served as the system's primary safety valve for decades. Under the new law, waivers require local unemployment to exceed 10%. The Brookings Institution determined that this threshold was reached nationally during only one single month of the entire Great Recession. In practice, this means waivers are unavailable for the vast majority of Americans, regardless of actual local hiring conditions for older workers with health limitations and employment gaps. You need to know about exemptions that were specifically removed from law. Veterans are no longer automatically exempt. If you served in the military and received SNAP, you must now meet the 80-hour requirement or qualify through a separate category like documented disability. The automatic exemption for individuals experiencing homelessness was eliminated. The caregiver exemption was narrowed. Previously, caring for any child under 18 in your household qualified you. Now the child must be under 14. If you are raising a teenager grandchild, that caregiving no longer provides protection. Youth aging out of foster care lost their automatic exemption as well. Exemptions that remain in effect require documentation to activate. You are exempt if you are 65 or older. You are exempt if you receive SSI, SSDI, or VA disability compensation. You are exempt if you are pregnant. You are exempt if you care for a child under 14 or an incapacitated household member. You are exempt if a physician, mental health professional, or caseworker certifies in writing that you cannot sustain 80 hours monthly of work activity due to physical or mental limitations. You are exempt if you are in a substance abuse treatment program. Native Americans, Alaska Natives, and enrolled tribal members are exempt under a new provision in this specific law. But none of these apply automatically. Everyone requires formal documentation submitted to your local benefits office. Without that documentation, you are processed as a non-exempt ABAWD. People with severe chronic conditions, documented disabilities, and obvious physical limitations are losing benefits daily because they assumed their condition was self-evident. It is not. The system demands paper proof on file. A 62-year-old warehouse worker in Ohio with arthritis in both shoulders and chronic back pain learned this the hard way. When his letter arrived classifying him as ABAWD and requiring 80 monthly hours, he assumed it was an error because he remembered people his age were always exempt. He ignored it. 3 months later, his EBT card was declined. His case was closed. He cannot receive benefits for 33 months. His arthritis would have qualified him for a medical exemption with one doctor's letter. He could have volunteered 20 hours a week at a food bank. He could have cited transportation barriers under the good cause provision. He had multiple paths to keeping benefits and used none of them because he trusted an outdated assumption about a law that no longer exists. 5 dangerous misconceptions are driving benefit loss across America right now. First, that adults over 55 are still exempt. They are not since November 2025. Second, that health conditions create automatic protection. They do not without written documentation filed with your caseworker. Nearly half of SNAP participants between 50 and 59 have qualifying disabilities, but many have never navigated the documentation process. Third, that veterans retain automatic exemption. They do not. Fourth, that states will issue waivers. Essentially impossible under the 10% threshold. Fifth, that few people are affected. CBO projects 4 million people monthly losing benefits. AARP confirms 1 in 6 older job seekers faces age discrimination. 60% of eligible older adults are not even enrolled in SNAP due to stigma, complexity, and lack of awareness about their rights. Your legal protections are powerful when exercised. Federal regulations at 7 CFR 273.15 guarantee a fair hearing within 90 days of an adverse notice. Filing within 10 to 15 days of receiving termination notice triggers mandatory benefit continuation during appeal. The state must decide within 45 days. You do not need formal disability status for medical exemption. A doctor's letter describing functional limitations suffices in most states. The good cause provision covers non-compliance caused by circumstances beyond your control, including medical emergencies, transportation failures, and family crises. Volunteering counts identically to paid work. Training, education, and workforce programs all satisfy the requirement. Your action plan requires 3 immediate steps. First, call your SNAP office today using fns.usda.gov/snap/state-directory. Ask your ABAWD classification status. Ask your compliance deadline. Ask what documentation your state accepts. Confirm your contact information is current in their system. Second, if you have any health limitation, see your doctor this week and get a letter stating you cannot sustain 80 hours monthly of work activity. Gather all disability verification letters, document any caregiving roles, submit everything proactively before your recertification. Third, if you can work or volunteer, start immediately and document every hour with dates, supervisor names, and contact information. Keep copies of everything you submit. If terminated, file a fair hearing request the same day you receive the notice. Filing within the initial window maintains your benefits during review. Every day of delay reduces your options permanently. The broader context demands awareness. Medicaid work requirements of 80 hours monthly take effect January 2027 for non-disabled adults 18 through 64 under this same legislation. States assume 75% of SNAP administrative costs starting fiscal year 2027, up from 50%. States with error rates above 6% must pay 5 to 15% of benefit costs by fiscal year 2028. SNAP nutrition education funding was eliminated October 2025. Future benefit growth is capped to inflation only. Crystal Fitzsimons of the Food Research and Action Center stated agencies need 12 to 18 months to implement changes of this magnitude but are being forced to rush, creating errors that fall on beneficiaries. SNAP lifted nearly 2 million adults over 50 out of poverty in 2022. In 2024, 13.7% of American households were food insecure. Food insecurity among older adults correlates directly with increased hospitalizations, worsened chronic disease, medication non-adherence, depression, and cognitive decline. This is not policy debate. This is your next meal and your health for the next 3 years. One phone call this week protects your benefits for 3 years. One missed deadline costs you for 3 years. Do not assume old rules still apply. Do not ignore official letters. Do not assume health conditions protect you without documentation. Act now. Share this video with every person between 55 and 64 who receives food assistance. Subscribe and turn on notifications because the follow-up covers state-by-state exemption guides, the complete fair hearing process, and the 2027 Medicaid requirements. Save this video for your next recertification date. This is USA Retirement Guide. Stay protected, stay informed, and never lose a benefit you deserve because nobody told you the rules had changed.